for joining. This is Solomon, leading the India Healthcare User Group. So this will be our first meetup. Just to share our speakers today, we have 4 great speakers today, and this is our agenda. So let me introduce the first speaker. Our first speaker's topic will be University of Chicago's Medicine Data-Driven Response to COVID-19. Mark is a business intelligence lead at University of Chicago Medicine. His current work is focused on driving engagement with Tableau through internal training, advanced dashboard development, and partnerships with IT. His previous work included developing dashboards for organization patient quality, safety, experience needs, and Mark is also a co-lead for the Virtual Healthcare User Group. Let's all welcome Mark.
Thanks for having me, Solomon. I will share my screen and get going. Cool. All right. So today, thanks for having me. I'm going to be presenting on UChicago Medicine's data-driven response to COVID-19. Quick agenda for this presentation, obviously intro. We'll talk a little bit about our response to COVID-19 and then review dashboard starters related to it. We do have a packed agenda, so for the Q&A, we'll likely have time for maybe one question, but feel free to put any questions in the Q&A and I'll follow up after my presentation. So intro, Solomon did kind of outline a little bit about me. I am a business intelligence lead at UChicago Medicine. I've been there for almost 4 years now. And my role is really focused on enabling and driving our engagement with business intelligence, primarily Tableau. I do have some previous work experience in clinical research and a background in bioengineering and bioinformatics. And like Solomon mentioned, I am also a current co-lead for the Virtual Healthcare User Group that has been meeting virtually and continue to meet virtually. If you do have any kind of questions or things like that that you're not able to get to today, feel free to reach out to me via email, or I am on Twitter as well with contact information there. Moving on. So UChicago Medicine, who are we, where are we at? We are a health system on the south side of Chicago in the US. We have 4 inpatient facilities and several different, I actually think that number is low now for our ambulatory clinics that we have throughout the south side and Chicagoland area. We do have just under 1,300 licensed beds across our inpatient facilities and a few other metrics here in terms of our volumes. Our team, so I work with our data and analytics team. We rely on data that are provided by our IT enterprise architecture group. So we are separate from IT. And we do really work in close partnership with them and are guided kind of by their security and privacy practices. We do have a data governance committee that helps ensure that we're using the most appropriate data for the needs that we have or that we're trying to fill for the organization. And our team that I'm on, it's a team of about, I believe, 10 to 11 right now, different analysts who really kind of work with different leads throughout the organization. We do use Tableau. We deployed Tableau server back in July 2017. Right now we're around 25,000 views quarterly. So that's any single hit to a workbook that's been published. The team that I sit on in data analytics, we are really heavily focused on quality reporting, but our Tableau server supports initiatives across many different departments. So clinical, finance, supply chain, HR, patient experience, operations, and research. So all of these different groups, we're all kind of using one single server for our organization. And I do want to call out that I am a team member of a larger team that does a lot of work, specifically the work that I'm here today to talk about as well. So COVID-19, it's definitely something worldwide. I think everyone's familiar with kind of the impact of it. And today I'm going to talk a little bit about how we as a data analytics team responded to COVID-19 and kind of what the asks were from our organization as it related to COVID-19. So when we started to see an uptick in the US as well as internationally, our team had already begun an operational response to COVID-19, trying to figure out what are the things that we need to do to ensure that we're able to meet an uptick in demand for the types of patients that would be coming to the hospital with COVID-19, and what are the things that we need to build out either operationally or within our labs or our EHR that would allow our organization to respond appropriately. So all of that work was beginning before we necessarily got plugged in to say, hey, we need a new dashboard to monitor the volumes of patients that are coming in. But what I would say is that while the organization was developing their operational response, the things that we were learning about COVID-19 seemed to change almost on a daily basis, definitely a weekly basis. So this created a very dynamic system that we were trying to capture from a data and analytics standpoint. So as things were getting built or tweaked or changed, we had to be dialed in, and that's where we started to kind of come in. We also knew that we would need real-time data. So for us, this was new in terms of things that we presented via Tableau. Typically, for real-time reporting, we would defer to it being within our EHR and just kind of displayed that way. But for this, we needed to pull in some real-time data because we had different data sources that we were working with. But this wasn't something that I kind of alluded to that our team could just do alone. We had to work very closely with clinicians, other analytics teams, so kind of breaking the silos from an analytics standpoint, as well as with our IT team to really leverage what we already had from an existing data architecture to meet the different needs that were coming to our organization. The other thing that we noticed is that there was this crazy uptick in the types of requests in terms of pure volume, and different groups asking for different things. You had stuff from the research side, you had stuff from the operational, you had stuff from different departments, different roles. What we really did that I think really helped with us is that we connected very quickly with our project management, and they were directly connected with the group that was leading the operational response to COVID-19. So this role really helped us prioritize and make sure that we had a real game plan in terms of when we were going to provide data to meet the most urgent needs first, and then work kind of chip our way down to get to secondary and tertiary needs for the organization. I think one of the things that was a kind of a quick lesson learned for us was that this work really required collaboration. So I think it was really interesting to see what happens when an entire organization is aligned on one single goal, and that was to support our organization's response to COVID-19. And it really kind of helped expedite if we needed to build something with our IT team, if it was a meeting with a clinician, if it was working with other analytics teams to figure out how we can kind of start and have the same language that we're talking as it pertains to our analytics. I think over the last couple of months, the collaboration really kind of took a next step for us, and that really was crucial for us when it came to producing our dashboards. So over the last several months, we actually created many different dashboards, and they were kind of a build to meet different asks that were coming up, different data that we were capturing. We had a real-time status dashboard, a census, workflow, patient outcomes, testing, all of those kinds of things. And it was really kind of interesting also to see, I think not as much of a surprise, but interesting to see that these dashboards quickly became the most used dashboards in our organization. They jumped leaps and bounds ahead of what we had seen in terms of previous engagement. And I think a large part of this was due to one, being aligned across the board. Every department, every role was focused on a response to COVID-19, so that definitely helped. And then I think the other thing that helped was really making sure that we were connected with our clinicians and we were providing data fresh data, data that could be acted on that can really help operationally determine what we need to do next when it comes to COVID-19. But what I want to spend a little bit of time today on, and kind of the bulk of the rest of my presentation on, are these dashboard starters. So what we know is that we weren't the only healthcare system that was responding to COVID-19. I think it's abundantly clear, and it's not just the US, it's across every different country. Many health systems were impacted by COVID-19. So we recognized that there was this new wave of data needs, and in talking with other contacts at different organizations, we found we weren't the only ones that felt like there was this wave of new requests coming in. I think one of the things that was counterintuitive for many is that COVID-19 also had a large financial impact on many different healthcare systems. And some organizations were forced to furlough or even lay off analytic and IT staff. So you had this weird dynamic of the most urgent data needs in recent history and a smaller workforce to meet that need. So recognizing that and talking internally with our leadership group, we decided to make public versions of the dashboards that we created for our internal use, but make them available for other organizations to use. Everything that we have in that is using dummy data, but it's the framework of our dashboards. So the idea here is that this data and these dashboards could be shared and allow other organizations that maybe were struggling to keep up with their kind of COVID-19 response to have a little bit of a jump start and then integrate their own data or kind of tweak as they need it. I do have the URL here. I am going to jump off at the end of my slides just to walk through some of these on Tableau Public for you. But I'm going to walk through them in the slide deck, and then we'll get to the presentation, to the live stuff. So the first one that we built was our COVID-19 real-time status. This was the first time that I had been involved with a Tableau report that read in real-time data. So that was really interesting to work with our IT staff to figure out what differences we have when it comes to a real-time feed, an HL7 feed, and how do you land that, how do you connect to that versus some of our relational data that we've worked with in the past. But this was really focused on giving us an up-to-the-minute status of how many patients were in the hospital that were COVID-19 positive compared to patients that we had under investigation. So potentially, but we're not sure yet. We're waiting for a lab result to come back. And this was really meant to just provide that pulse of the demand that COVID-19 was placing on our health system. It also incorporated some of our testing volume so we could see how many different tests were being run and the positivity rate of those tests over time. Another one that we released is our census. So this is looking more specifically at how many patients are in a house, how many of those are confirmed, how many are PUI. This was on a one-day lag for us internally, but it helped us kind of identify where we had patients throughout the hospital, and then how have we trended over time. We also incorporated some information around our mechanical ventilator use in there as well, and broke that out by COVID or not. The third one that we created was specifically around workflow timing. I think one of the things that you wouldn't initially think of, but is really important, is that up until the point of clearing a patient and saying they do not have COVID, and we're confident that they don't have COVID, or we're very confident, it was a hit on the amount of PPE and precautions and care that was required to take care of that patient. You have to treat every potential COVID patient like they have COVID until you know they don't. So one of the things that was important was to track the time for us to clear or confirm a patient. So we created a dashboard that really kind of broke down what that time looked like, as well as individual process steps along the way to help with that. Another dashboard that we created was around patient outcomes. So that was kind of the next stage. There's who's in the house, and then what happened after patients were actually admitted, and kind of what were their outcomes like. So this broke out things around length of stay, ICU, and then kind of mortality. So we had an idea of what was happening to these COVID patients, and people could break down data into different groups. For us, one of the other really important things that we integrated here that I haven't highlighted in other dashboards yet was the ability to break down and disaggregate by different demographics. So looking at race, because I know that has been that was something that came out very early, relatively speaking, in terms of the impact of COVID-19 on different races and different demographics. So we wanted to be able to incorporate that and check that internally with our dashboards as well. Another one that we had was specifically around the ICU. So looking at the percentage of patients who get admitted to the ICU, how long they're staying there, if they are progressing positively, if they need to come back, if they're using mechanical ventilation, all of those kinds of things we wanted to track to have another lens and a deeper dive into the impact on our ICU specifically. And then the last one that I'll talk about is just our testing. So this one, in a similar way as our patient outcomes, allowed any analyst or anyone diving into this data, like administrators or care teams, to look at the pure volume of tests that we were providing, as well as our positivity rate for those tests, and again, break it out by different populations and things like zip code, to be able to really look at where you might have higher positivity rates or not for us. So before I get to the thank you, I will pull up just here we go, the Tableau Public. So our team does have this data and analytics. That's our public facing Tableau Public page. You can search on Tableau Public for it should you want. I'm going to go through just a couple of them in the interest of time. I'm going to go to the real-time one, and then I'll do the workflow timing. So there's a disclaimer on it, and I'll put it again in the video. Again, everything that I'm going to show here, it has our brand on it, but it's all dummy data. It's the framework of the report that I really want to highlight. So this one, for how we use it, it's a real-time feed. It looks at the percentage of the volume of our confirmed patients, our PUIs, and then breaks them out by the location. And I have it set up here. If you have a larger health system where you're looking at it by hospital, you would break it out that way, but you have the ability to also look at it by unit. And it color codes by if they're under investigation, so a PUI, or a confirmed patient. Scrolling down, not the prettiest trend line, but when you feed in your own data, it cleans out and looks pretty clean. Looking at our test completed, test in progress, patients with completed tests, and then patients who have tested positive. And the idea here is you can track your volume over time and track your positivity rate. Moving down, again, another just reminder on the disclaimer, not real MRNs, not real patients here, but you do have that ability to look at for an individual test, if you have somebody positive, if you have somebody negative, all of that information is there. And one thing we did with the Tableau Public versions is you do have the ability to click for an overview, and it'll write, this will get into weeds that I don't necessarily have the time today to dive into, but it'll highlight why we built the dashboard the way we did, as well as provide a little bit of the data model that we had for that report. And the last one I'll do before wrapping up today, let's do the workflow timing. I think this is probably the prettiest one, and it has a lot of good information in it. Again, disclaimer, not our real data. But this dashboard, this one was created by Whitney Westfall on our team and Mega Killaru. They work together to pull this data, and it really looks at our time from when we were investigating whether or not that patient was COVID positive to them being confirmed or cleared. So the idea here is that you could look at what that average time looks like and really keep an idea on that. And we set some internal targets for that. And then kind of moving down, you have the ability to look at it by different kind of processes that we had within our own workflow. So we had time to first status, so that would be they arrived maybe in the ED to the time that we said they were potentially a patient or even confirmed them. Time from then to when we actually ordered the test, when we got the results, when we enrolled them as PUI or confirmed. And then this one, the SRP, is our respiratory precautions. So the things that was a specific order to make sure that we were taken the necessary precautions for our patients in care. So, and you did have the ability to look at it, see if it changed by different populations or different outcomes. So if the patient went home, do they have a different time than if they were discharged to a skilled nursing facility, all of those kinds of things. And again, the last thing I'll say, if you want, and you're in these, kind of hovering a little weird, you do have the ability to click to kind of get a little bit more information on it. All of the dashboards that we have here have those. You can kind of see it in the little thumbnails, the click for overview. But with that, I will wrap up a little minute over, but I think hopefully, Solomon, I don't know if any questions came in, but happy to answer one now and then follow up on the chat if needed.
Thank you, Mark, for the interesting dashboards. And we have a couple of questions. The first question is, are there any data analytics that you developed in response to COVID-19 that you will carry forward into normal life?
That's a really good question. And I'm almost mad I didn't mention it. Before we began any of the work, we really tried to be thoughtful about how we built our underlying data architecture if we identified the potential for it to be a report that exists post-COVID-19. So things like our census report, we really built, where we actually built out what was our census and then just identify our COVID patients as kind of a left join off of that. So the idea there is that in the future, hopefully we have a vaccine, there's no more COVID-19. All we have to do is pull that table off and you have a standing report. So we did really try to identify those types of reports. I think the census one was a big one. The other one that I would say was really critical was looking at some of our ICU and ventilator data. It was something that historically we have struggled to report on. And this really kind of forced the dive to figure out the best ways to report that information and establish what's just our ventilator use, and then figure out of that who is COVID-19 or not. So for a lot of things, we definitely thought about what's the long-term vision even after COVID-19. That's a really good question.
And the second question is, for demographic data, which variable besides race was used? Other than race, what are the other variables?
Yep, that's another really great question. And one thing I didn't mention as well, we're fortunate enough to have a diversity, inclusion, and equity team within our organization. And we partner really closely with them and have done other work around looking at patient equity, especially as it relates to quality care. And we leverage that. So we look at race, gender, age, zip code, ethnicity. I think I might have said language. Those are kind of the key ones that we start with. We know that there's a lot of other social determinants of health and other metrics like that. I think there's an opportunity to go even lower than zip code to kind of the like census group or those kinds of things. The one thing I would add, just as anyone starts to kind of look at patient demographic information, that we have found you're only as good as how that data is being captured when it comes to reporting that. So if there aren't standard ways that organizations are documenting race, ethnicity, language, and all of that, you can run into potential data quality issues. But for us, it's really important that we're at least having that conversation and calling that out. That's a really good question.
Okay. So no more questions.
Cool.
Yeah.
Turn it over.
Thank you, Mark, for your time.
Yeah.
So I think that covers the first topic. The second speaker is Ella. She is the head of information at Specialist Mental Health and Learning Disabilities provider based in the east of Manchester, UK. Ella discovered Tableau over 5 years ago and since embedded Tableau within Pennine Care as the main data visualization and reporting tool for the organization. Ella runs 2 UK Tableau user groups, Northwest and a healthcare user group. Ella was made a Tableau user group ambassador in 2019. Welcome, Ella.
Thank you, Solomon. That was great. And Mark, that was a great presentation. Thank you. Really useful to see. Let me try and share my screen now. Hopefully you can all see that. Thank you for having me, everybody. Get to the next slide. Okay. Thank you for having me, as I've just said. So Solomon's done a bit of my introduction, but just to kind of talk through why I walk around holding signs above my head that say Datalicious. I discovered Tableau about 5 years ago, so I've got about 5 years of Tableau experience, and I think I can easily say that it's been fairly life-changing. I never would have imagined 5 years ago that I would be presenting to an India Tableau user group from my living room. So that's it's definitely had a bit of an impact on me. So I'm a head of information, so I manage an analyst and data warehouse team for a trust in the north of England, and I'm working for the National Health Service in the UK. I do run 2 user groups, so I really kind of think these forums are really useful to bring people together. So I run one in the north of England and the UK Healthcare Tug, which has allowed me to kind of build up my network and meet so many different people, and allows me to bring people together, which I get a real buzz from, but I find them really useful. Because of my passion, I think I was made the Tableau user group ambassador, which is a really great honour. And then last year I had the excitement of winning, or being awarded, I should say, the Tableau Community Founder Award winner, which gave me the opportunity to attend the Tableau Las Vegas conference last November, which is amazing. It was, I found out about 10 days before I was going, and it was a bit of a whirlwind. So I got to spend 5 days in the US for work, which is pretty unseen for us working in the NHS in England. You don't really get that opportunity very often, so that was very exciting. I've made sure I passed my desktop qualified associate exam a couple of years ago, just to make sure I did know what I was talking about with Tableau, and I think that's a really useful thing to do. I thought it'd be fairly easy, but it was actually really hard, but I'd learned so much during the revision that it's well worth kind of topping up your skills by doing some of these certifications. So that's me. I am obsessed with Tableau, and I like talking about it. Pennine Care, so as I said, this is part of a trust or an organisation that's based in the north of England. I'm giving you a little map just in case you're not really clear. But we, as at the implementation of Tableau, which is what it's talk about, we were a specialist mental health and community services provider, so providing mental health services, both inpatient and community-based services, so going out to see our patients in the home and in outpatients, but also serving community services, which is things like physiotherapy, district nursing, children's nursing, lots of variety, but all kind of based, travelling all over the East Manchester. So we covered 6 areas of Manchester with a population of 1.3 million. We've got 200 different types of services across 250 sites and 5,500 employees, which is at the time of Tableau. Things have changed recently. We're now a specialist mental health service, but we're still providing data and information for all the old legacy ones as well. So that's kind of the kind of organisation I work for. And I was keen to talk about our journey with Tableau to kind of help to understand how it's become such a, I suppose, a real passion of mine, because it's made such a difference. But thinking back to about 4 or 5 years ago, whenever we were looking at our data or producing reports, it took hours and hours, 25 hours of work, which was, I suppose, a bit of a churn. We used to produce the same reports every month, and it would take a lot of hours and a lot of manpower to produce the same amount of information, which wouldn't go down very well. People weren't very engaged with it. People didn't believe what it was saying, and also it was out of date as soon as produced it. So when we produced it in either Excel or through SQL reporting services, it was a snapshot in time. So as soon as it went into people's hands, it was slightly out of date, and as the longer they started to hold on to it, and by the end of the month, it was completely out of date. So it felt like a real churn, and it was just such a manual process. So I felt like we were a bit of a distribution center, and it felt like you didn't get much reward from it. So we knew we needed a solution to really help people to engage with the data, to really help them to use data to gain better intelligence, make better judgments. But there was kind of no kind of thirst 5 years ago to kind of invest in a business intelligence tool. So that was a real challenge for me, and a fairly laborious process. So we definitely needed a solution. And luckily, about At the end of 2014, I made a discovery. I went to a conference and saw a 10-minute demonstration of Tableau, and I was absolutely sold. I presume because you're all here now that you're all pretty into Tableau already, so I won't try and sell it to you. But I was pretty amazed in terms of what they could show you in 10 minutes and how you could connect so easily to data, which has been the biggest challenge. That allowed us to buy a couple of desktop licenses once I saw that this could make a big difference to our organisation. Again, I didn't have the investment, so it was about trying to work out whether this solution could really make a difference. So we trialled it, a few of us, a few senior managers in Pennine Care to see what a difference has made. And I can honestly say since the beginning of 2015, I've hardly touched Excel. When I have to, I have no clue what I'm doing anymore. So it's really replaced any kind of technology. But during that trial, we really started to see the power that it could have on our data and what we could do. Luckily, during the summer of 2015, I got a little bit of money to be able to roll out a pilot and got some engagement from one of our areas. So one district of Manchester and community services that were really interested in improving their data and getting more, making it clearer, making it more accessible. So we've run a quick pilot. I ran it on my own because I was keen to kind of protect my team who was snowed under with business as usual and demand that I couldn't sideline them to do it. So I spent one day a week managing a pilot and rolling out Tableau with some help in terms of getting the data sets live. But we had the pilot, which kicked off in 2015 in October. And pretty much within a few days of it being live, it was an overnight success. And they'd originally identified 10 managers that we wanted to get access to Tableau to. It replaced all our routine reporting. And so we shared that with the 10 managers who can access Tableau through a Tableau server. And within a couple of weeks, they agreed that we needed 25 managers at least. By the middle of the pilot, we had 50 managers out in Oldham who were accessing it because they recognised that everyone who had some management responsibility needed access to Tableau. So it's pretty amazing how much of an impact it made without, obviously there was a bit of effort, but not as much effort as I would imagine in terms of engagement. They quickly recognised that if they have the data in their fingertips that they can drill into and find out the answers, that they quickly become engaged. I remember at the beginning of the pilot, quite a lot of senior managers were kind of a bit anxious about having another system that they needed to use. Technology is always a bit of a challenge with clinicians who are busy trying to do clinical work, and the technology isn't always suitable. So they were a bit anxious about getting Tableau, but I went into a meeting with a couple of senior managers who was always, they have to provide a narrative around KPIs. And during that meeting, there was a massive U-turn around how useful this kind of technology could be. We got underneath the reasons why a KPI was always failing. We thought it was one reason, but when we drilled into it, it was the opposite. And that was kind of enlightening. And as soon as we did that discovery, then they wanted to make more and more and more. And then team managers went on to be some of the biggest advocates of the Tableau pilot and really helped to make us get it in place for the rest of the organisation. So by May 2016, it took a few months to get the business case off the ground, just in terms of people's, again, I suppose, spending money on a technology that it wasn't that well known in the NHS at that point, and it wasn't something we'd done before. There's lots of IT projects that really struggle. So it took a bit of time to convince people, but the pilot was such a success, and I had the backing of all the operational managers out in one area saying that this would make a difference to everybody, that during that time I managed to set up all the infrastructure to allow us to go live as soon as the money got agreed. So in May 2016, we'd done some of the hard work and copied everything over so we could roll it out. So within a month, we'd rolled it out to all the other areas of community services. So by June 2016, we'd rolled it out to 250 staff. And then a month later, we'd rolled it out to all our mental health service managers as well. So within a couple of months of saying we would go live, we were live, and we'd replaced all our routine reporting from that point on. So we streamlined everything, and everyone was getting a similar format and more, because during the pilot we'd managed to go from routine reporting to extra intelligence, because every time we released more and more data, there was more, it drove a demand for more and more information. It really kind of helped to gain that kind of momentum in terms of what people can get out of it when they've got the right technology. And my biggest challenge, not only rolling out Tableau, was I had a really fixed deadline to get it rolled out and to make sure my team were equipped and the organisation was embedded, because I had a slight another deadline that I needed to reach. So by September of 2016, I was due to give birth, and as probably people know, there isn't much movement on that deadline compared to most deadlines in work. There's always some flexibility, but when a baby's coming, they're coming. So I had to make sure from, I suppose, around May to July, August time, that I'd not only rolled it out across the trust to X amount of managers and operational managers, that I'd made sure my team were equipped to manage Tableau going forward as I took time off to have the baby. And I did it. So we rolled it out and managed to get Tableau live and leave it in safe hands before I went off and had a baby. So it was a lot of pressure, but I think I found it quite nice to have a deadline that I couldn't, I suppose, get away from. And since then, as I said, the pilot was such a massive success, but when we rolled it out trust-wide, it was also a massive success. We did a bit of a survey a year later, and this is just a bit of a snapshot in terms of the impact it made to, I suppose, having that data on tap through Tableau. It made such a difference that we got some responses back to see, well, what difference did it actually make? So this is just a few comments that were made from a variety of different types of staff in our organisation. And specifically, this question was around data quality. We've already struggled with kind of the data quality in our systems, again, because when we sent reports out, they couldn't get underneath the bonnet. They couldn't see what it was related to, which patients it related to, or what referrals or what activity it was, to enable them to fix the data quality. And it also stopped us from having data quality tools. It was just around having the data available and then being able to see underneath it. So it had a big impact on data quality, and a lot of people said it did make a difference. And there's a few that we still need to work on and work out why it didn't, but some really positive feedback from a data quality point of view. Do you feel Tableau's increased your ability to improve the way you and your team works? This was a really good question in terms of, I never realised how much of a difference having a business intelligence tool could make, and having that data available. I always thought it would make a difference to my team in terms of streamlining and saving us loads of time, but I never could estimate what impact it would actually have on services. But there was a lot of intelligence they could gain from Tableau and the data that we're providing in this way. And we managed to get extra funding from certain areas, and it has improved the way they work operational, because they could see and they could get access to data that would really change the way that they saw things. So really kind of positive response. And then got them all posing and looking at Tableau, some of our nurses and staff. And this was just a quote from one of our senior managers, the ones that kind of manage the pilot. But it wasn't just about having the data. They started to take responsibility for data quality and their own performance. Before, it was always seen as kind of a central problem because they couldn't own the data well enough, because they didn't have the tools in place. When we put Tableau in place and they could actually manage the data and have their own dashboards, they started taking responsibility and realizing they could fix their own data quality because they could see what it actually was, and they can see what impact it was having. So quickly they started to take ownership of their performance and data quality, and that's got to be a massive bonus of having Tableau in place, and took so much pressure off my teams in terms of having to try and work out how to fix everything for people and take that responsibility. So it made a big difference, hence the reason why we got a business case successfully signed off, and continue to roll out Tableau. So a massive buzz, and very motivational from my point of view. Now, 3.5, nearly 4 years on, we've got now 20 Tableau desktop users. So my team's expanded because of the rollout of Tableau, and I guess the data world's changed massively, as people, you will all know that the data is in demand more than it's ever been before. Definitely grown since I became an analyst 15 years ago. The types of requests we used to get compared to now is totally different. So I did manage to expand my team because people started to recognize how much value we could really add. So we went from, I think, 5 or 6 Tableau desktop users when we first did the pilot and the implementation. We're now up to 20 Tableau desktop users. Most of them sit in my team, but there's the odd one in finance and a couple in other areas that started to use Tableau desktop to produce data and bring everything together. We've got over 800 people accessing Tableau server, and that, in terms of daily and weekly usage, has grown and grown and grown. Especially over the last couple of years, we've done a lot more work to try and engage people and not just have them looking at it on a monthly basis like they used to their old data. So getting people to have stuff that really helps them. So we've got over 800 users, and they're accessing it daily, weekly, whatever they kind of need to. we've got thousands of dashboards. I say 1,000 plus. We've probably got more than that. One thing I've learned over the last 4 years is that I could never have predicted how many dashboards we would end up with, and how many questions could be asked of our data. I think pre-Tableau, I was very naive about how much you could produce. I always thought that we'd get to a point where we'd dished everything out and we'd get into the really complicated questions, but we're still delivering some basic dashboards, and they're growing and growing and growing. So I think when you're rolling out Tableau, it's hard to estimate how big it could get. So our server is creaking, not only because we've had challenges upgrading, not because of Tableau, more to do with our infrastructure and our funding, but we're on the verge of trying to, I suppose, get back to where we need to be and streamline the processes and improve our content and make sure we're not duplicated and just trying to keep everybody happy. So we have got thousands of dashboards. We've got a lot more data in our data warehouse and in Tableau than we did 5 years ago. So we're now looking at workforce data, finance, clinical safety, and patient information. So we've got a lot in there to bring together and triangulate and make sense of. And a growing demand for data. I think when I did a similar presentation this time last year, our demand over the 18 months previous had more than doubled, not just in terms of how many requests we're getting through, but how many people are asking for data. There's a lot more people individually asking for stuff than ever before now. So we've got a lot more engagement from different areas of the business. I think in terms of, I suppose, the question that I was answering, or my purpose of the presentation was to talk about engagement. And it's not just as simple as rolling out Tableau. There was some initial easy wins, quick wins in terms of having Tableau in place, but it's really easy to overlook some really basic stuff that's really going to help to make sure people do engage. There's 2 angles that we looked at based on learning from the Tableau community, other organisations that do similar stuff, that we needed to make sure that both my staff in my team and people who were doing the data analytics and the data analysis or the dashboard developments understood what they needed, what skills do they need to be able to really drive a data-driven organisation, I suppose. So one angle is that we needed to make sure that our analysts, or as we start to think about them, are they analysts, are they data translators, they're all of this. And it was really clear quite early on that they were no longer going to be able to be stuck behind a desk. They need to start to really engage with our operational managers, as our clinical services, to really get them to really understand the data. So we've got different levels of, I suppose, training and support that we need to make sure our analysts and data translators have the right skills to do the best job they can do. So we've nicked some inspiration from VizChick, who created a Rookie to Rockstar skill framework, which is really worth a look. We've adapted it to help our team to really progress. And it doesn't just look at, I suppose, the Tableau technical, learning Tableau technically, so the technical training to make sure you can know which button to press and how to create charts. It's not just touches on data visualization. And over the last 3 or 4 years, we've done a lot of work with my team around making sure we've got the right data visualization skills. And that's something that people can't learn overnight. It's something that we really need to work on. It was something we never had to think about before because we never had the capacity to present data a lot. We had to just get it out there and distribute it in the best way we could. It didn't have to be perfect because we didn't have the time or the tools to do it. So now we really work on our data visualization skills, also working on our analysis skills, making sure that when we get a request in for a piece of information, that we understand why people are asking for it. So we're solving problems with the data rather than just giving them a report that says X, Y, and Z based on what they've asked for, making sure that's actually going to go back. Because what we've learned over the years is someone asks for a piece of data, you send it to them, and then they go, oh no, I didn't want it quite like that. I wanted it sliced in this way. Then you do it again and you keep doing it. And finally, you probably get it right. But if we can ask the right questions up front and really understand, so using the kind of 5 why methodology, work out what they're trying to solve, what's the data really going to do for them to make a difference. So really getting our skills up in terms of the team to make sure we have the right skills. So we've got a Rookie to Rockstar framework, was inspired by VizChick, and we try to use that as our kind of competency framework to get our skills really up in the team. So we do lots of challenges, and we take inspiration from the Tableau community. We encourage them to do Makeover Monday, Project Health Biz, what else? Workout Wednesdays, and storytelling with data. All these things that are available in the Tableau community have been a massive help and really helped us to kind of get this competency framework up and getting our skills progress to enable us to be a great resource for the organisation. So that's the data side. So that's the team who are delivering the reports and the dashboards and the data. And then we've got the data consumers, and this can't be underestimated. We've got a good support network that we created. I learned from a lot of other people that rolled out Tableau and how it really works. So we have to make sure that we're supporting these, our users, our operational managers, our clinicians, our senior managers. You can't just roll out technology and expect them to get it. So there's the angle of making sure they're supported, because data literacy skills are underestimated as well. People don't necessarily come into healthcare, especially at a clinical level, and have automatic data literacy skills. So you can't expect them just to go, that's a chart, and they know what it means. I think we've all been exposed to a lot of charts over the last 3 months during COVID that you can be blinded by what it's saying. People can mess with the charts to make them say one thing. So you've got to make sure that, one, that we're delivering the right sort of information that's not going to be misconstrued, but also to make sure that we have the right data literacy skills. So we provide fortnightly clinics for our managers and staff so they can drop in and get Tableau support. So we've, pre-COVID, we used to have them based out in different areas of the organisation. So every couple of weeks we'd be available for them to drop in and get support. We go to teams directly and present and find out what they need to know. Do they know how to use Tableau? Do they know how to interpret the charts? And so we're available. We're looking at kind of working on a remote model now so that people can get in touch with us remotely a bit easily. So we're looking at virtual clinics. So we're trying to adapt the way we do it. And then these kind of things that we were thinking about before COVID and having to change our support model. And then the data literacy skills, as well as kind of going out and supporting people and trying to make sure the dashboards we create are being consumed in the right way. We've done quite a lot of workshops to upskill quite large areas of the organisation to make sure they understand what charts are telling them. Why would we use a line chart versus an area chart versus a bar chart? And what does it mean when we do it? And just trying to build up people's understanding of how it all fits together. How does the data get out of our systems in the first place? Because people need to understand how it works, because people think there's some magic that happens and we're messing with the figures and stuff. So there's a lot of data literacy skills that need to be considered, probably in most organisations, but definitely in healthcare, in terms of making sure that as people have progressed up through management in healthcare, that they've got the right skills to be able to get the data and make the right decisions using it, because that's what it's about. It's about having the right dashboards, having the right data, and then making the right decisions based on what it's telling them. If they make the wrong one, it's really dangerous. So then data literacy skills is something that we take quite seriously at Pennine Care. And our aim ultimately in Pennine Care is to be data driven, so that we take the data and use it as evidence to drive our decisions, whether it's operational decisions, whether it's strategic decisions, whether it's planning, whether it's anything. We're trying to make sure that data is at the heart of it. This is a long journey. We've rolled out Tableau, as I said, like nearly 4 years ago, and we're still, there's so much more we can do. It's a growing beast, but we need to still work on that culture of getting data at the heart of it. It's been really interesting during COVID around, we've had to spin up, as Mark has, collecting lots of data around COVID to understand the impact on services, both from staffing to our patients with mental health. So looking at the impact it's had on our mental health services and trying to predict what might happen. We know there might be a massive surge in our mental health demand because of people in lockdown and because of impact of COVID long term. So it's trying to work that out. So the data always has to be at the centre of it. So trying to make sure it is. So we're looking at new ways of doing that. We implemented some weekly huddles with our exec team about a year ago to see whether, if we kind of concentrated on certain KPIs and certain measures, that we could really work out what was going on if we use the data before we kind of made any judgments. So really trying to make that as a heart of all our decision making, both for planning and the here and now. So it's an interesting time, but it can't be underestimated how much support you need to put around people to make data a real asset in the organisation. And that's pretty much it. Thank you for listening. I've got a Twitter handle if you want to follow me. If you've got any questions that you think of down the line, drop me an email. Quite happy to. I love talking about Tableau. And I've got a blog. I started a blog last year. I've been a bit, not done much in the last few months. I've been a bit distracted with home and COVID and all that, but I'm hoping to write a few more blogs. They're a bit mixed, but read them if you've got time. Have we got any questions? Let's stop sharing.
Thank you, Ella, for your Tableau journey, for sharing your Tableau journey. We have one question. What did you do to increase data literacy in your organization? How did you get to move the users away from the Excel tables to visuals?
think early days, and still do now, do a lot of engagement around the visuals, trying to explain that Excel tables versus visual graphics make a big difference. So done a lot of work directly with individuals and workshops where we've explained the two. So kind of brought up a table of data and then brought up lots of charts to say this is telling you this, whereas when you present it in or a bad chart or even in Excel, it doesn't quite do what it does. So we've done a lot of workshops, done a lot of promotion. I'd say that one of the biggest things is really kind of been promoting the use of data. I think the word data was even something that was a bit innocuous. 4 years ago, people weren't comfortable with that word, and now it's trying to get people to kind of not be scared of it. I think like people are scared of technology, people are a bit scared of data, that if they get it wrong, they're going to get something else wrong and make a bad decision. So it's just trying to engage them. So I think that we've done a lot of work around the visuals and promotion and getting people supported. So the support mechanism, having the drop-ins, having the community there within Pennine to support our users. But yeah, a series of workshops basically, trying to get, I suppose, a series of Tableau champions. So there's not one set of people just in my team that are experts in charts, actually kind of rolling out to other departments, so that all our kind of support services are experts in charts, so that when they're faced with them out with our operational managers, they're able to support. So kind of growing that kind of Tableau champions out in services, as many people as possible, understanding what it all means and allowing people to know that they can ask questions. We don't assume they're going to always understand, so kind of making it an open community so people will feel comfortable asking when they don't understand.
Thank you, Ella. Your speech will be inspiring to our healthcare professionals. Hope they will adopt to the Tableau culture.
Thank you very much for having me.
Yeah. Let's move on to the third speaker. Christian. Christian is a staff programmer, analyst at Roche Tissue Diagnostics. He has a bachelor's and master's degree in finance from the University of Arizona. He has been using Tableau since 2013, and he is a Tableau featured author, and he's also a Tableau qualified associate, and he is a 4-time winner of the Whiz of the Day. I'm very happy to welcome Christian.
Thank you, Solomon. I appreciate the invitation to speak, and great job to the other presenters. Let me pull up my screen here. Okay. So as Solomon mentioned, my name is Christian Felix. The title of the presentation today is going to be Dashboard Development for End User Adoption. Just by way of agenda, the focus of the presentation is going to be design principles or development principles for user adoption. But before I get into that, I just wanted to provide some context about who I am and the company I work for and my involvement in the Tableau public community. So this is a Tableau visual resume. Some of you may have seen these out there. I decided to put mine together a couple years ago. And the things I want to highlight here is, as Solomon mentioned, I have a finance degree from the University of Arizona, a bachelor's and a master's. I started using Tableau back in 2013 as a master's student in analytics at Texas A&M. So there's free student licenses that the company makes available. I found that the tool was much more efficient and effective in terms of data exploration and data visualization than some of the tools that we were using. And so I immediately fell in love with it. The company I was working for at the time was called Raytheon. And I was working initially in finance, but then in IT. We were using SAP Business Objects for much of our business intelligence. And shortly after I adopted the tool at Texas A&M or started using it, we rolled it out to the business at Raytheon. About 5 years ago, I came on board at Roche, and I've been working in Tableau, SQL, Alteryx on a daily basis at Roche to stand up a self-service business intelligence program there as well. So this is just a fun way to communicate a little information about myself. If you haven't seen the Tableau visual resumes, I have a great gallery out there. You can search and see some others for inspiration. So by way of the community, I participate in Project Health Viz. Lindsay Betzendahl runs that. It's a way for me just to create, to design, sort of expand my horizons in terms of skills and things I'm doing in Tableau. If you haven't checked it out, I thoroughly recommend that you check out the project. It's a great way to get involved in the greater healthcare conversation. So I've received 4 Viz of the Days. Every time it's an unexpected honor, and I appreciate being recognized by Tableau in those ways. These are just 4 examples of visualizations that I've put together that have been awarded Viz of the Day. I also co-lead the Tucson Tableau user group. So back before the whole quarantine and lockdown things begun, we were meeting at various companies in Tucson. We met at the University of Arizona, our last meeting before lockdown. We had a great sort of collaborative event with the students and industry professionals. Just a great way to sort of demonstrate and Tableau and communicate some excitement and some passion for the tool and what you're able to do with it. So I work for Roche. Roche is one of the largest biotech companies in the world. I personally don't work on the pharmaceutical side. I work on the diagnostics side. One of the things that we're on the forefront of is personalized medicine. So the concept where certain people respond to different medications better based on how they're wired or based off of their DNA. So we are on the forefront of that and innovating in that area. We've been in the news recently with the coronavirus tests that we've released, our molecular tests back in March, and more recently the antibody test in May. So it's a great time to be working for the company, very proud. And there's just a great satisfaction in the ways that we're able to contribute to the larger world community and the issues that we're all facing. Okay, so dashboard development for end user adoption. There's really 5 different things that I want to cover in this presentation. And before I dive into that, just a little more context. So I don't work in IT at Roche. I work directly in the business. So when I talk about user adoption, I'm talking about people in the business who may not be the analyst type, but who need to consume our dashboards to understand their information. So these are users who are consuming our Tableau information resources, typically via Tableau server. So how do we get those users to engage and to understand our tools? We have roughly 700 distinct users per month coming from all over the world. So we're a global company. So we have the challenge of making sure we're communicating data and our information in a way that is cross-cultural, sort of transcends any sort of boundaries that may exist in a global business environment. So the first principle is trust, all right? And I just want to say what we found out the hard way sometimes, and I'm sure those of you working in IT analytics have found this out as well. It doesn't matter how beautiful your design is, doesn't matter what best practices you follow in terms of layout, visual design. If your data is inaccurate, then people aren't going to adopt your tools. They're going to be skeptical, and they're going to go back to doing it the old way. So what we want to do, what we've tried to do, and what we've done a fairly good job at, is ensuring that we know if there's an issue in our data before our customers do. So we don't want to receive the emails Monday morning saying, hey, I think there's an issue with this report. Can you look into it? And have it basically throw everything off. We want to understand data issues before our stakeholders do. One of the ways we do that is we have a data source health dashboard. We have a Google site that we allow all of our dashboard consumers to navigate to. And as part of that site, we have a health status dashboard. What you're looking at is basically a Tableau dashboard with all of our different data sources, not all of them, but many of them that contain our highly used reports. And each of these is basically an individual worksheet with Tableau alerts attached to them. So whenever we notice the data source basically not having an update date for 2, 3, 5 days, an email alert will get triggered to us indicating that there's an issue with the data source. So this helps us be in front of any data load issues that are out of our control, but we still want to be aware of. Secondly, we look at the issue where the data loads successfully, but perhaps there is an issue with the load itself. So it loads, but the data in the load is incorrect. So we also have just dummy dashboards or dashboards set up specifically to answer the question, has the data changed? So we pick a point in time that we know is stable, we know the data is accurate, and we'll freeze it, and then we'll connect the live data source, and we set an alert to help us identify basically if the underlying data has changed enough to trigger that alert. If so, we'll get an email, and we'll go back and investigate with our IT team why the data changed and get it corrected. Another aspect of that is just transparent communication. So we try and communicate to our users. We have a Google Plus community where many of our users are able to collaborate, and we try and communicate any known or unexpected downtime immediately, as quickly as possible through that channel. So trying to ensure that they're not unexpectedly going to show up in a meeting and have the server unavailable, that they are aware of any downtime and they could make preparations beforehand. So in addition to trust, secondly, consistency. We try to ensure that all of our dashboards maintain a consistent layout. So we use standard templates. This helps our users know where to find things in the dashboard. There's a standard header that communicates the name of the report, the department, the measures used, the time periods used within the dashboard so they know what time frame they're looking at. Filtering is all in a specific location. Standard iconography, such that people know what a particular image does in terms of an icon. And then footer information that helps the user understand, first of all, who's looking at it, what time they're looking at it, what data source they're connected to, when the last data update was, when this dashboard was published, some version control, and things like that. So this sort of consistent framework and layout has really helped users go from dashboard to dashboard and know where to find what they need to consume the information. Secondly, we have, Roche is a big company, so we have a very exceptional department of designers, graphic artists that helps us develop things associated with the company brand. One of those things is color. So we use the Roche color palette in all our dashboards just to make sure that the web-based communications that we're putting out in terms of our Tableau work matches the company standards and the other web-based communications that are out there within the company. In addition to colors, standard shapes and iconography are used in all our dashboards. Things to go to home, information buttons that contain additional information about the tools, going back, forward, and documentation, all standard icons that are used throughout our dashboards. Another thing that we've standardized is basically when to use certain charts. I mentioned colors, fonts, etc. These things are all standard across all of our dashboards, such that our branding is aligned with the other informational resources that the company puts out. Another recommendation I'd have is just the success PDF and sort of rules that the Hickert and Weiss group puts out. If you haven't heard of those, recommend checking them out. Very informative in terms of business communications. Okay, so the third thing is flexibility. This is an example of one of our dashboards. In many of our dashboards, we allow the user to basically view the information how they want to view it. Sometimes that's in a bar chart, sometimes it's in a map, sometimes it's in a small multiple view. This was developed, golly, I think it was before 2019, version 2019. So all this was done via action filters. Now, I mean, you can swap sheets using parameter actions, using show, hide, container buttons, but there's multiple ways to do it. But one way of achieving flexibility is basically allowing the user to decide what way they want to view the information. So that's one thing that we do. This is a tweet that caught my attention that really resonated with me. Perhaps it resonates with you, by a guy named Robert Rouse. He's sort of lamenting the modern analytic process of going from the source system to the database to ETL, cleaning, transforming to Tableau, and then the user downloads the data and analyzes in Excel. And he says, you know, it's true, and it is true. And we've found that out, and we don't try and fight it. So, of course, we try and make sure all of our dashboards up front answer the question such that a user can go directly to the dashboard and find out the answer they're looking for immediately without having to do additional work. That's a sign that we're developing per the user's needs and effectively, but we also ensure that the user knows how to and can easily download the data. So all of our dashboards can easily be clicked through to a table that then the user just follows the standard known protocol of downloading into CSV from Tableau server. And so we make that available just to achieve some flexibility to align with their desired workflow. This is another one of our dashboards that is meant to be sort of a comprehensive reliability monitoring layout, tracking various reliability metrics. In all of these metrics, we allow the user to click through if they want to see this smaller visual in a larger format, to either export to PowerPoint or to take into an image or a PDF or a presentation. In each of these dashboards, we allow the user to click through a bar chart and again, get to the underlying data for that month. We allow the user to enter targets in here, such that if they want to track how they're performing to a certain metric, they can enter a target, get a KPI symbol, save their custom view, and return to it on a monthly basis to basically see how their area is doing. So those are just ways we introduce some flexibility into the tools. We also offer some additional icons on the footer of each of our dashboards to ensure that our users can connect with us immediately if they need to via email. We have overview videos to show them how to use the dashboards, and we provide them the ability to give us some feedback via just a quick, simple survey on how the dashboard is either helping them or needs to be modified to help them more. I mentioned the videos. We're trying to make sure that our users know how to take advantage of all of the options within Tableau server to increase their efficiency. So things like creating custom views. We have quick, easy videos. Creating alerts. We want to make sure they know how to do that because it's an awesome feature. Subscribing via email. We want to make sure our users know how to do that so that they don't have to go to the Tableau server every time. They can just subscribe to an email and get their information directly in their inbox. So trying to make sure that there's various ways to meet the requirements of the customer and make it easy on them. So in that same vein, the fourth one I wanted to talk about is productivity. So trust, consistency, flexibility, and productivity. Of course, one of the ways to enable productivity from an end user perspective is allowing them to do something they were never able to do before. And Tableau allows that just in an amazing way. So this particular dashboard was built by my colleague, Naveen Chebrolo, an amazing Tableau developer. And it brings together all these different sources of information into a single source of truth and a single view that a user can go and see how their particular instrument or product is performing. All the data here is either removed or anonymized, such that it's not real data, of course, but it gives you a feel for what we're doing in Tableau, what the capabilities are, and how we've just enabled our users to get the information they need. A second thing we've done to increase productivity is we've made it as easy as possible. We've tried to make it as easy as possible to allow the users to get the reports, find the reports they're looking for. So this is just an example of a portal. It's a Tableau dashboard that basically categorizes and organizes our different reports into different areas. So if a user comes to our Google site and knows that they want a report on, let's say, instruments, they can come to our portal and start searching perhaps in this category, things like that. Okay, another thing we've tried to do to increase productivity is embed accessibility directly into their workflow. So I'm not sure how familiar you are with Chrome extensions. It requires a bit of JavaScript, but you can create a Chrome extension that basically allows a user, in this case, to directly access our portal and our reports within their web browser in a quick, easy, streamlined process. I'm not an expert at JavaScript, but I have access to people who are. And do some Googling, you can find out, I think, how relatively easy it is with some basic JavaScript to create a Chrome extension. Similarly, we've embedded access to our Tableau dashboards directly in our Salesforce system. So if we have people working in Salesforce, there's icons directly in their Salesforce cases that they can click. And then instead of going directly out to Tableau server, there's sort of a nodal window that comes up directly in their Salesforce that shows the Tableau dashboard. So this embeds our informational tools directly in their work process, making things much more productive for them. The last thing I'll talk about is ownership. One thing we've started doing is podcasting. So we call it a podcast, but it's basically just a recorded conversation with one of the real users of our tools. And so this is an example. We're calling it dashboarding in the real world. So it's a conversation between the developers and the end user, just trying to give them an opportunity to tell their story of how the tool that we've created has helped them with their process. So they'll walk through how they use our tools, and this will all be recorded, made available on our community for other people to consume and see. And what we often find is that after they tell their story, we show them additional features that the dashboard can do that they were never aware of. And so it's an opportunity to cultivate ownership because the end user is really telling their story of how the tool has helped them. But it's also an opportunity for them to learn more things the tool can do, and for us to learn really how the tool is being used in the real world. I mentioned the Google Plus community. We keep this live, not just with status updates on our servers and things like that, but just with best practices, access to the Tableau e-learning, which was free for the last 90 days, and other things that we think would be of interest to our community. So yeah, ownership. That's really all I had. I know I went quickly, and I believe I'm wrapping up before the 25-minute mark, but that's okay because I do have a hard stop here at the turn of the hour. So I'll again thank Solomon for the invitation here, and I'll open it up for questions.
Thanks, Christian. It was an informative session. and uh, and the principles behind it. That's very nice. We have a couple of questions. What's better in Tableau compared to BO or Cognos? Is it only visualization focused? Your experience with the BO versus Tableau.
I'm sorry, Solomon, can you say that again?
What's better in Tableau compared to BO?
Oh, I see. Yeah, I think it's really not a debate, in my opinion. We have both tools available at Roche, and I think many other people find Tableau to be way more efficient and intuitive to use, easy to use and develop in, and way more effective at communicating data in a visually appealing, easy to understand way. Much quicker in terms of the development process as well too. So my opinion, and I think it's shared by many others, is that Tableau is superior.
So so there's another generic question from a master's student. He's asking, can Tableau alone be a career path, or someone should be equally good in other aspects of data science?
Yeah, I think Tableau is a tool in the toolkit. It's one aspect of it, and it's used heavily, at least in our company and many others. But obviously, you want to be proficient in other areas such as SQL, such as programming, R, Python, and really you want to be proficient at communicating your results. So you want to grow in areas of presentation and the ability to communicate and translate what you're seeing in the data to how it should impact the business process or the stakeholders' world, basically. So yeah, it's multifaceted.
Okay. So the final question is, can you provide some details on how to embed Tableau dashboards in Salesforce?
Yeah, that was not something I accomplished. My colleague Naveen Chabrolu did that. There's things out there you can Google and research to understand how you can do that. If I get the time at some point, perhaps I'll dive into it a bit more and blog on it myself. But I believe there's others who have covered that in the Tableau community, and I'd point you to those resources. Perhaps I can do so myself after this meeting.
Thanks, Christian. Now let's move on to the final speaker, Avinash. Avinash has over 9+ years of experience in BI, data management, and data visualization. He's a senior data visualization specialist at Pramerica, based on Ireland. He has more than 5 years of experience in Tableau and participating in various visualization challenges like Makeover Monday, Post Quiz Sunday, Project Health Quiz, etc. He loves data, and let's all welcome our home speaker, Mr. Avinash.
Yeah, thanks, Solomon. Thanks for the introduction. I'm going to share my screen. So, Solomon, could you please confirm if you can see my screen?
Yeah.
Okay, thanks. So thanks, Solomon, for the introduction and inviting me for the session. So myself, Avinash, and Solomon already introduced about me. So I'm basically from India. So currently I've been working as a data visualization specialist with Pramerica Systems. It's a part of Prudential financial company based out of Ireland. And I have overall or around 10 years of experience in business intelligence and data management. And I've been working with the Tableau from last 5 years. I really found Tableau is interesting for me, and I keep continue my journey with that. And most part of my experience, I worked in healthcare and financial industries. So this is a financial industry or investment banking company right now I'm working. So earlier to this, I work with United Health Group, that's a healthcare company. I'm a visual evangelist. I really love Tableau, and I've been working or active in Tableau public community from last 4.7 or close to 5 years. And I will create a lot of dashboards using publicly available data sets, and I publish in Tableau Publics. I received 2 Viz of the Day awards from Tableau, and I'm going to show just a screenshot of those in next slide. And most part of my Tableau public work includes Makeover Monday, Sports with Sunday, and Project Health Wiz. So I would encourage everyone could take a or just participate in those visualization challenges to improve your data visualization skills. So these two are just the images of the Viz of the days. These 2 Vizes got selected for the Viz of the days. And moving to the next slide. So today's topic is how or why data visualization matters in healthcare and how it would improve the performance. I'm going to cover some of the dashboards which I have created earlier. So those are not related to any company, or just I use the public data. So before I'm going to jump into the dashboards, so let me give some introduction about how data visualization helps in healthcare. So efficient, meaningful data analysis is some of today's most important thing in medical studies. So you might aware of so many medical studies. Even in current COVID-19 situation, most of the countries are using visualization massively to see how they're progressing with day-to-day cases in terms of confirmation, recovery, serious or critical, and so on and so forth. And also with the red zone areas or orange or green zone areas. So it's also essential for physicians, nurses, and other health professionals during their day-to-day practice, as they interact with health interfaces and databases to generate reports, as well as they can also review the information and trends. But while they're interacting with all of the databases which is linked to health, so sometimes it's a massive. So the massive data is little used without data visualization. So this is where the data visualization comes into the picture. So let me take an example of the iceberg, which I have here. So you can consider this as a database. I can only see 20% of the iceberg, the remaining 80% is down in the water. So let's consider this as a database. And if you like to use the entire database to give or identify the data anomalies, or I wanted to give some insights to the end users out of it. So that's where the data visualization plays the most or key role to reveal the insights. So Tableau is one of such a powerful data visualization tool in current market, and we could use the Tableau on a number of databases to reveal the insights out of these kind of databases. And also data visualization brings the most important takeaways in health industry into focus, and also help us to identify patterns, correlations, and makes data analysis more efficient. So I'm going to show you a couple of the examples or dashboards that I created earlier by using Tableau. So the first one is the COVID-19 or coronavirus stats that I created for US. So this is a simple dashboard that would show, or which would be helpful to identify the spots of highly or most affected areas or states in the US. So if I can see this dashboard, my eyes will immediately go into this particular state, so which is in New York, and this is the most affected state. By the way, this is not up to date dashboard, so which I updated on long ago, but still I can see what are the most affected areas around the date, and you can just hover over on any of the states, so you can see how the left panel is changing with confirmed, recovered, disease, and serious cases. And I'm going to show you another example is that Teledoc stock performance dashboard that I have created for Project Health Wiz. So and again, the visualization is not only meant for patients or medical or clinical data in healthcare. So we could also create some of the dashboards using Tableau. So to showcase how the stock of a healthcare company is performing. So this is one of the dashboard that I created for Project HealthWiz. So in this dashboard, I'm going to show you or gives the information like what is the average open, low, and high price of this particular company, and also the average volume of stock associated with this. And on the left side, I'm covering the year over year growth in terms of stock rates. So you can see how it has been changing from year over year. And also this is the line chart. So also I have provided some flexibility for the end users, which they can enter the values and it's going to update the color. So for example, if I would like to see only for 2017 year, so I can select 2017 year. And I also have a flexibility to set this lower band and upper band like 20, and it's going to update the line chart simply like that. And I can see from February until December, I can say like the stock is within the range between 20 to 100, or maybe I can send this upper band to 40 or 30. So it's going to update and it's in between that range. And going to the third example is the outpatient treatments in America for 2015 year. So I'm going to show the dashboard. So this dashboard I have created while I started or beginning my career in Tableau on maybe 2 or 3 years ago. So this dashboard covers 9 unique outpatient treatments. So you can simply click on any of the particular icon and it's going to update the dashboard. And you can also observe like which state dealt with most of the cases, and you can easily click on any of the particular icon and it's going to update in terms of how many providers supported these many outpatient treatments, and what is the volume of the treatments count, and what is the state that dealt with most of the state treatments. Sorry. And coming to the fourth dashboard, as I mentioned before, it's not always about the patient or some clinical data. So this is something fun I created using Tableau. So I know in our day-to-day life, we're gonna consume a lot of fruits, but I hope 90% of the people, they are not really aware that what kind of nutrition they can get out from those fruits. Let's say if I do the hover over on apple, and it's gonna tell me what kind of benefits that I can get while eating the apple. And also you can see the bottom 2 sections, it got updated, and I'm gonna get that kind of a nutrition value if I eat an apple. So again, it depends on the size. So I haven't covered any of the size of the particular fruit. But if you see the apple, it doesn't give any of the fat. You can see the 0. But avocado, so this is my favorite food. But if I just hover over an avocado, it is giving me 10 grams of fat, but still I have been eating. So this is something fun. So you can just hover over on any fruit that which you like most. So it's going to give the nutrition value, and also it's going to give some of the benefits that we can get out from that fruit. So going back or going forward to the next slide. So this is the dashboard that I'm going to spend most of the time today. So like how I started this dashboard, or what kind of approach I have been followed while creating this dashboard. So this is a dashboard that I created just 2 days ago on the lockdown phases of India and how the confirmed cases has been changing over a period of time or through different kind of lockdown phases. So this data or dashboard has been broken down by the states by considering confirmed cases, active cases, recovered cases, and disease cases. So before you need to create, or what kind of steps that you need to consider before creating any dashboard, or maybe these are all the steps I would follow. Either it could be a companies or real-time dashboard or whatever the dashboard that I'm going to create for fun in Tableau Public. The first and foremost or top priority is the data. So as Kristen mentioned earlier, so identifying or the right data is primary thing while creating any of the dashboard. So we need to identify the right data. So once we identify the data, either if it's a public dashboard, you need to download the data, and probably you might or you may need to apply some data cleansing techniques if it requires. So for this COVID-19 data that I downloaded for India, so I downloaded from one of the websites which is publicly available, so anyone can download the data, and I'm going to show the links in next slide. So once I downloaded data, I applied some kind of data cleansing steps, and later I applied a pivot concept which is available in the Tableau. So once I identify the data, later I performed some analysis. While doing the analysis or analyzing the phase, so once I analyze the data and I identify the important metrics that I would like to consider for my visualization. So once I identify the important metrics, later I built a story based on the important metrics and what I wanted to convey to my audience or end users. So the third phase is the create. So whatever the story that you build in an analysis phase, that you need to create some chart. So here you need to choose the right chart types, and also you need to keep your story into visual form. Finally, you need to add some colors to it to make it more beautiful. So once you are done with the 3 steps, you need to publish the dashboard and make it available for the end users. So now I'm going to talk about the data cleansing steps that I applied for this particular dashboard. So I downloaded the data from this particular link. So you can just copy paste the link in the browser. So it's going to download the data automatically in CSV file. And I removed some unwanted columns or the columns which I don't want to utilize for my analysis. So this is the data set. So the column TT, which gives a total number of cases for all of the states, which I don't want to include in my analysis. So I simply deleted this column and saved the file, and I connected that file to my Tableau. So once I connected that file to the Tableau, so here what I did is I applied a pivot concept. The reason behind that is if you see the data, so all of the states are in individual columns, but I don't want to use the states in individual columns. I wanted to take them in row wise. So for that, I need to transpose the data. If I started doing the transposing manually, it would take at least 2 to 3 hours of time because I have 30 different states and close to 90 individual days. So it would take massive time to transpose the data. So what I did is I connected my data set as it is to Tableau, and I selected all of the columns, and I don't want to include these 2 columns for doing or by applying the pivot. So once I selected all of the columns which I would like to take into the pivot, and simply I can right click and I can just hit the pivot. So Tableau is going to do all of the work for you within fraction of seconds. So later you need to rename the columns. So I would like to call this column name as state and this column name as cases. So later I can write the formulas, whatever I want on top of this data set, and I have started creating the dashboard. So till now I spoke about the process or the analysis or the steps that I have been followed while creating the dashboard. So now it's time to talk about the dashboard functionality. So I'm going to the actual dashboard that I created 2 days ago. So I just divided this dashboard into 2 sections. So the top section and the bottom section, or the section 1 and section 2. So in the first or top section, I would like to show the analysis by daily, and also I would like to show it's a cumulative trend. And in the bottom section, I would like to show the data or confirmed cases based on the states. And also, I'm interested to see or showcase how the confirmed cases has been transformed through different phases of the lockdown, and how how the ease of lockdown or giving relief in lockdown guidelines in India is impacting or sparking up the corona cases. So here in the top section, I'm just showing the total confirmed cases, and this is a count of the cases that are confirmed on today, or maybe whatever the date that I updated. It's on the 10th June 2020. So I can change this to cumulative trend. So and you can see the running total of the confirmed cases. And also coming to the second section, so the India started the Janata curfew, which is a massive one, on March 22nd. So later it applied the lockdown first phase, so which went for 21 days. And if you observe all of the different phases of these lockdowns, after phase 1, the government of India is giving some relief in lockdown guidelines that leads to bump up the cases in terms. So you can see the most affected states are Maharashtra, Tamil Nadu, Delhi, and Gujarat in terms of confirmed cases. And also in first lockdown, we had very less number in terms of confirmed cases, and later it has been increased very massively. And I also had given some color here. So you can see the color bucketing of the confirmed cases here. So this particular color or white color, so we don't have any kind of reported cases. And you can also see, maybe if I consider the state Maharashtra, from April 27th until 10th of the June, each and every day that state has been reported with 500 plus COVID-19 cases. And this dashboard also have the flexibility to choose or to click on any of the particular phase, and it would show the analysis or change the analysis in the top section. And I can also provided some flexibility to the users, so they can click on the state whatever they belongs to or wherever they are interested. So and it's going to update the entire dashboard through different phases, how the cases has been reported. And also you can see the top section, it's going to update, and you can see the bumps down or up in terms of active, recovered, and deceased. Apart from that, I had given some sort by functionality based on confirmed cases, active cases, and recovered cases, so on and so forth. So by default, I set this to confirmed cases. So if somebody is interested to see or highlight the states or to take the states in top priority, so they can simply click on the active cases and it's going to change the order of the states. So in similar way, I'm going to choose the sorting or utilize the sorting functionality on whatever the category that I want, and it's going to update the dashboard. So with that, I would like to thank Solomon and other co-speakers for giving me the opportunity, and I'm open up for the questions.
Thank you, Avinash, for the practical sessions and the colorful dashboard. It was very useful. We have one question. How the images link with particular data from the data set? So when you are clicking the image.
So, okay. So I have used the action filter. Maybe if I remember it correctly, I have used the images on outpatient treatments in America dashboard. So I have used action filters in that particular dashboard. So when I click on the particular image, so it's going to give or take the relevant information related to that. I hope that answers the question.
Sorry, there was a miss. Hello.
Yeah, hello.
Yeah. My audio got disconnected. Yeah.
Okay, no problem.
Yeah. So that lockdown and cases dashboard was awesome. It's nice.
Yeah, thank you so much.
Yeah. Thank you, Avinash.
Yeah, thanks for the opportunity.
Yeah. So let's move on to the last session of the event. So the topic, so why this high hug? Why India Healthcare User Group now? So we all know that health is a basic right. UN declared that it is one of the fundamental rights of a human being. But we also have to understand that health is also our responsibility. Responsibility of an individual person plus the responsibility of government, policymakers, public health agencies, academic and research organizations, hospitals, diagnostic and testing laboratories, pharmaceuticals, medical device manufacturers, health insurance companies, other NGOs and CSRs. They do a great job, and other related fields and sectors. For example, we should understand that health is not a single sector. So let's say road injuries. So it also depends on the transport department. So how good the road is. Also, if even the mental health depends on the occupational health, the schools, everything. Also, we have recently we have healthcare IT companies and startups who does a great job in this 21st century of data, what we call the era of data era. So these healthcare IT companies and startups are doing tremendous jobs. This is an research. This is a finding from an American Health Information Management Association. They say that the healthcare industry is in the midst of a data revolution, storing more information than ever before. So here, what we see the opportunity is, it is the same organization said that it is projected that it is going to grow faster than any other industries through to 25. So what we actually need is more health data professionals. To me, the health data professionals are either they can be an healthcare professionals, plus if they learn some computer skills, they can become a health data professionals, or the other way around is computer professionals can learn some health. They can have some health data experience, or they can learn some health projects. Then they can become a health data professional. So either way, there is two things. There is very evident that we need these skills to become a health data professional. That is, first we need a subject knowledge and how the health works, how the health system works, what are the stakeholders behind the health of a nation, everything. Then we should have statistics knowledge. Then we need computer programming skills, coding skills, or Python, etc. Then the final thing is the storytelling part, which nobody talks about in this data science field. So these three they focus, but this they forget to tell about it. But I find the storytelling part will be the action. This will be the action part. No matter how good you are at statistics, coding, or subject knowledge, once you cannot, if you're not able to convey your message, once the people cannot take decisions based on your findings, then the whole research is complete waste. So here comes the Tableau. I found Tableau a very useful, even I can say the tool for storytelling, the best tool for storytelling. So there is another quote from Rahul Gandhi. He said, "What oil is to Saudi Arabia, data is to India, and Indian healthcare data will shape global healthcare." So because the population and the amount of data we are generating, it's huge. We have seen that that iceberg photo, right? So this is how the Indian data is there. It is still in different form, not in a database form. So we have a huge opportunity in India to become a health data professionals. So why we started this HUG, which stands for India Healthcare User Group. The vision is very simple. We like to be a resourceful community in health data culture. The post COVID-19, we are sure that the healthcare industry, healthcare data industry is going to boom, and we like to be a resourceful community in this data culture. And our mission is to learn and share health data visualizations and knowledge and skills through these kind of meetings. So next, for the audience, if you want to join our community, you can join in the given link. So it's, even if you can search in the Google like India Healthcare User Group Tableau, so you will find our community. So where we will share our regular updates and other things. So the next Tableau meetup will be on 26th June. These are the two speakers, Mansi and Bonnie. And there we will have an interactive sessions and networking for the audiences. And I like to thank Caroline, Shibu, Sagar, Frederick, Divya, Lakshminarayan, and Lokesh Reddy for making this event successful. Thank you.